come in here.
Okay, faster.
Okay, here we go. So this is what a normal dog knee looks like, okay? And the big thing, this black section right here, this triangle, that's where all your ligaments and where your menisci live inside your knee, and this is called the patellar tendon. And dogs, their angle, especially how they walk, is completely different from a human knee. The slope of it is different. That is why when they blow their cruciate ligament, like when we blow our ACL, they need to get a plate in it to move that angle a little bit better. But I want you to pay attention to this section, how smooth this tibia is. This is the tibia bone. Let's look at our handsome friend's knee. This is solid arthritis, and this is a giant spike of arthritis. So even if he
That's
ever...
That's at the knee.
This is the knee. So I wanted to start with the knee. We took a picture of the whole leg, but even if he does put weight on it, this arthritis is piercing into where his ligaments, his menisci, and all of his nerves live in his leg. Like, it is severe. Here's his toes, and we got a comparison of the other side in the same view. This left leg, the bones are nice and aligned. We can see all of the joint spaces. And here he's got arthritis, basically what's equivalent to what is our ankle, okay? So he's got arthritis in his ankle. Right here too is where he has that nerve damage sensation, where he doesn't feel a lot of stuff right there. He's also super sensitive to his toes. One other thing is I noticed that he actually has dermatitis between two of his toes. They're stuck together. It smells like athlete's foot basically.
Oh.
And it's just because moisture gets trapped there. He's not using it. So like...
Is that why he smells his toes sometimes?
Yeah, and it smells like bad corn chips. And it's only between two toes. And I'll show you since he's still a little sedate. But arthritis right here, like, do you see and that how you can see that nice clear line right here?
Yeah.
You can see that nice clear line. You can't in this one because it's basically fused with arthritis. Okay. The knee is the most concerning. His pelvis on the side actually looks pretty adequate, but when we look at it on his back, he does have a little hip dysplasia towards this right affected knee. He has a little bit in this left one as well, but it doesn't look like he's making a ton of arthritis in his hip right now. So that's good. And this is kind of like on his back, the best I could get with his leg because his leg is so contracted down. Okay?
Gotcha.
Yeah, it's just...
So your opinion is that it might be in the best interest to lose a leg?
Yeah, because it's just so painful. It's so painful.
My wife has a worry about ghost pain. What are your thoughts about that?
Ghost pain is very, very rare. Phantom pain.
Phantom.
So we originate phantom pain through humans, and it mainly happened in dogs when they used to amputate below the pelvis. So right now we do something called a coxofemoral dislocation. So we take off the entire leg, the femur included, at this hip joint, if that makes sense.
Yeah.
And that kind of allows us to eliminate the likelihood of phantom pain. It happens in less than, I want to say 2% of all dogs. The other thing to consider with him is his other limb probably has some arthritis. I can see that his hip is not the greatest and he's a little overweight, which we already knew. He's lost some weight. So he is not going to compensate as well with losing a limb as a fit dog would, or a younger dog would, or a dog that doesn't have a lot of arthritis. The reason we would consider it in him is because he's so painful, for one, and two, he's already compensated all of that weight on the other leg, that it would be basically just removing dead weight from the other leg.
So from that respect, it would be a positive thing.
Yes, yeah, because that leg is just horrendously painful. Like, even if, like I said, this giant spike that's in here, even if you got that, like, for him to put weight on it, he's still going to be super, super painful.
Okay.
Now, he is a candidate for a new monoclonal drug. It's a monoclonal antibody called Librela.
We've talked about that. I think the consensus was that we weren't sure that was because that's an osteoarthritis thing or an arthritis thing.
Which he has a lot of.
Okay.
So that would be at least something to try and do. It's going to do absolutely nothing for his nerves whatsoever at all, but it's to control the pain. And if we can control his pain, then he can also keep the leg is the other thing.
If we can control his pain, would there be any possibility that he could eventually get use of it? Or
Yeah, it could.
Okay, so that would be a modality that we could include along with the PT that I'm doing.
Yes, exactly. And we do have it here.
I'm totally open to doing that.
I think that would be a good one. Like I said, it's going to do nothing for his nerve damage that's there, but it's going to help with arthritis pain, and controlling his pain is what's in the best quality of life for him.
Okay, so that's in a scenario that we're not removing the leg.
It would
or
be for
both.
both.
It'd be for both.
both.
So we start there with both legs, and is that kind of what you're suggesting?
Yeah, let's start with keep doing physical therapy, see if we can get his pain controlled. And if we can get his pain controlled, then we can keep that leg. If absolutely he keeps, doing the crying and it's just hurting all the time, then we amputate it. And we keep doing the Librela injections because he's got arthritis on the other side too. Because that's the thing. A lot of times when it comes to amputation in this scenario, we go, oh, they're not a candidate because of the arthritis. Well, he's been compensating so much on the other side that side's affecting him so much. That's why it's a big pros and cons thing to weigh. Mm-hmm. It would be just removing that extra dead weight that he's carrying around in his scenario.
Okay. Gosh, I'm just so torn between what to do. But if there's a chance that we can improve and not quite yet take it, it sounds like you're okay with that?
Oh, 100%. Yeah. Okay. Let's start with the Librela injections. Now, actually, last Wednesday got to do a continuing education with the person that made it and ask him all the hard-hitting questions about it and learn the big broken down science of the drug. The drug reps tell us you have to give it at least 2 dosages to see the full effect. What I've noticed is within like 48, 72 hours, dogs are feeling really good. And he did say, because what it does is it blocks a pain receptor called nerve growth factor that's affiliated with arthritis specifically. That's the reason dogs, their first month or their second month will see such a big improvement, and then they kind of taper off and get to a more controlled dose because they're now used to having a settled amount of pain. So his first 1 or 2 months, he might feel really good, and then 3-4 months, he might seem like he's more at a stable state where you don't see as drastic of a difference. Okay. So we'll just.
But then by that time, he might have made some progress.
Correct.
Muscle.
That's the big thing. Yeah, that we want to see some progress.
All right. Well, that's what I want to do then.
Okay. Let me bring that in. We can just do it in here. It just is given right underneath your skin once a month.
Okay.
Okay. But we'll add that to his multifactorial physical therapy and medications that he's on. Yeah. It doesn't interfere with the gabapentin that he's on, or tramadol, or any Chinese herbs. You can give the carprofen to him with it. It just doesn't have any long-term studies after, I think, 3 weeks. But the whole goal with Librela too is to be able to back up on some of the pain medications too, because you're blocking that pain.
Well, he's been taking the carprofen and gabapentin for over almost 2 years. So.
Which might be nice that if we do see a difference, we might be able to give it to him once a day instead